You've probably heard your guy friends talking about penis turtling. The thing is, there's a big difference between what most men call turtling and what doctors define as turtling. Some of what I'm about to tell you may come as a surprise, but let's look at what medical science defines as turtling syndrome, how it's diagnosed, and what you can do to fix it. When a flaccid penis retracts, it looks like a turtle pulling its head into its shell, hence the term turtling. There are lots of guys out there who turtle all the time, and it can have a really negative effect on a man's self-esteem. But why does it happen? Well, before we get into why a penis gets smaller, let's talk about what causes an erection, since the two are actually linked. Think back to when you were a teen and everything worked perfectly down there. Let's say you saw, heard, or felt something you found sexy. This triggered a signal in your brain to tell your body to pump blood into the spongy tissue inside the penis, known as the corpus cavernosum. The edges of these two long sponges would also expand to let in as much blood as possible. Once the corpora were completely full, the organ would seal itself to hold in all the blood and maintain the erection. Then, your brain would send another signal to release all the blood, usually once you achieved orgasm or had a strong emotion such as fear, like that time your mom walked in on you. So that's the long and short of what makes a penis go from long to short. Okay, so why does a flaccid penis change size throughout the day? There are tons of reasons why this happens, but we'll focus on the top 4. Did you know you have muscles in your penis? There's the dartus fascia, a thin muscle just above the penis that runs down the inside of the shaft, and the cremaster muscle that sits under the epidermis along the inner shaft and runs down into the scrotum where it wraps around the testes. When your penis is warm, these muscles relax and you're able to hang loose. But when coming into contact with cool air or water, for example, these muscles contract and draw the penis inward. A great example of this is when you experience shrinkage after swimming. You've probably heard that men have a sexual thought about every 15 seconds. This can cause a flaccid penis to get a little bigger, but negative emotions can also cause the flaccid penis to shrink. When we experience stress, anxiety, embarrassment, or fear, we unconsciously send a message for the dartus to retract the penis and for the cremaster to pull the scrotum inward. That's because these penile muscles are activated by sympathetic nerve responses. Men who suffer constant stress and those with resonating pain from a chronic injury are likely to turtle a lot because of this. Here's one that can actually make the flaccid penis a little larger. The perineum is the roughly 2-inch long area between your scrotum and your anus. It's full of layers of connective tissue, fatty tissue, muscles, and membranes, and also houses the pudendal nerve, which then branches into the penis. Stimulating the perineum usually causes an increase in flaccid penis size. This is why you may have noticed your manhood get a little bigger after a bowel movement. Meds like Adderall, certain antidepressants and antipsychotics, and even drugs prescribed for an enlarged prostate can all cause the penis to shrink. The biggest offender here seems to be amphetamines, most commonly used in the treatment of ADHD symptoms. So now we can see that changes in penis size throughout the day are totally normal. But what if you've noticed your penis always stays small when flaccid, or has been getting shorter and shorter over time? You might be suffering from some version of turtling syndrome. The good news is that all are fixable, but the solutions vary in terms of medical complexity, so it's important to know which version you're dealing with. Now let's talk about the 5 most common causes of turtling syndrome and how they're treated. Keep in mind that these can happen to men of any age, but are more common in those over 40. We also see a lot of guys with more than one of these conditions at once, and the effects can be debilitating. Here they are in reverse order. Inadequate arterial flow is most common in men over the age of 50, men with type 2 diabetes who have or have had an elevated A1C level near double digits, and men who have had prostate surgery. With aging, fat builds up in the arteries and causes blood to flow too slowly for a rapid erection to occur. This is known as arterial stiffness, and it can also cause the cells in the corpus cavernosa to break down since they're no longer getting enough blood. Inadequate arterial flow also causes turtling syndrome and an overall decrease in flaccid penis size since there's not as much blood available to support the penis at rest. If you've noticed it takes you longer to get an erection, that you're still not totally hard when you do, or your flaccid size has been going down, you'll want to see a doctor who can take a look with a color duplex Doppler sonography test. Do not let anyone con you by using a handheld Doppler testing unit. The readings from these inadequate and ancient devices only show the problem exists, and they're incapable of narrowing in on the source of the problem. Your doctor might recommend some things you can do on your own to combat inadequate arterial flow. These might include taking supplements, quitting smoking, starting to exercise regularly, or even using a penis pump. Your doctor may also prescribe a generic PDE5 inhibitor. However, if your doctor deems your arterial flow to be too low for erect penile performance, the only known curative therapy is at least 20 treatments on an external counterpulsation bed. The dartus fascia is a thin muscle inside the pelvis that connects the shaft to the scrotum. Sometimes the dartus becomes detached, usually for one of 2 reasons: natural weakening from aging or because of a genetically engorged suprapubic fat pad or GEFP. More on GEFPs later. For men with a detached dartus, their flaccid penis resembles a pair of old socks sagging around the ankles. Most men suffering from dartus detachment have about 80% of their penis inside their body when flaccid. Once the dartus detaches, the body starts to slowly reabsorb the skin and underlying tissues of the penis, starting at the base. Eventually, this means a loss of sexual and urologic function, not to mention a severely smaller penis. A detached dartus should only be repaired through surgery performed by a highly skilled reconstructive urologist. At Rejuvall, we can't perform a lengthening procedure at the same time as a dartus repair because we use the deep ligaments as an anchor during urologic reconstruction. What we can do is to add on a surgical removal of the suprapubic fat pad and tightening of surrounding skin when we repair the dartus, which usually means a longer penis in the end for most of our patients. If we were to do all of those things without reconstructing the dartus, the penile shaft would just continue to break down, and eventually all critical penile functions would be lost. Coming in at number 3, an overactive sympathetic nervous system is one of the most common culprits for turtling syndrome. This is most common in men with anxiety disorders or high-stress lifestyles. Remember our friends, the cremaster and dartus muscles? They both help support the penis and its position relative to the scrotum. They're also both activated by the body's sympathetic nervous system, the same system responsible for our fight or flight responses during moments of stress or fear. This is why men who are shy about disrobing in front of others in a public dressing area like the gym will get smaller from the anxiety of that experience. Some men suffer from an overactive cremaster reflex, triggering a reduction in flaccid size with little or no stimuli. Patients with anxiety disorders are the most prone in this category to suffer from chronic turtling and will want to talk to their doctor about medications that can treat this underlying mental disorder. Men with an overactive cremaster reflex are most effectively treated with non-surgical application of dermal fillers sculpted within the penile shaft. As a result of the cremaster reflex, a flaccid penis naturally experiences a decrease in blood flow. However, the bulk and weight contributed by injected dermal agents will usually offset this reaction.